Petersen is a physician at the Borland-Groover Clinic. Dr. Petersen, it's good to see you, sir. Thanks for being here. Let's talk about your role at Borland-Groover and then also what sets you guys apart from other practices.
Well, it's a group of 70-plus men and women that are gastroenterologists or hepatologists, liver specialists as well, that take care of all digestive issues from the mouth to the bottom end.
And so what do you specialize in specifically?
Well, I do a little bit of everything, not only stomach disorders, a lot with the liver, pancreas, bile system, but we're all skilled in all aspects of gastroenterology.
And one of the things you're seeing, you say, in your practice is something called gastroparesis.
Right.
What is that?
It's a disorder of the stomach where the stomach actually loses its ability to accept a meal, to grind the meal, to get rid of the meal. And that's a basic function that we all have to have. And when you can't do that, you're chronically nauseated. You vomit frequently, you become dehydrated, you lose weight, you can't function.
So this is pretty severe. I mean, you're not talking about mild symptoms of just getting a stomach ache.
Right.
You're saying this is to the point where you physically can't keep some food down.
Usually seen in diabetics, but we also see it in people that are healthy that have had a viral illness, and then that virus affects the way the stomach operates from its nervous supply. So when those nerves are damaged, the stomach doesn't function.
Okay.
So we're left with a stomach that really needs some help, and the medical therapy doesn't seem to be doing much. The pills are not working as well as we would like.
So let's say someone has these symptoms, then they have this nausea, and so the first step I would imagine, come in to see you guys.
Right.
What do you do from there?
There's studies that we can do. We look inside the stomach to make sure that there's no blockage or problem. We do what's called a gastric emptying study, where we give a small meal and watch how that meal is being digested and how it leaves the stomach. But when we find that it's slow and dysfunctional, then we have gastroparesis.
Okay, and then is this treatable? This is something that you can treat entirely?
Yeah, well, we use medications. There's three big ones: Reglan, erythromycin, another one called domperidone. Maybe half the people we give it to, it's effective, but the rest of them are just stuck. And some of them end up having surgery on their stomach. Some are fed intravenously for the rest of their lives. So that's why this new technique, new technology came along.
Before we get into the new technology, very quickly, is this something that's not hereditary, not something that you're born with? This is something that can come up later in life, you said, just from
Definitely. Yeah.
a virus or...
Post-viral, it can be part of connective tissue disorders, but it commonly is in diabetics.
Okay.
Juveniles, for sure, very common. Probably 30–40% juveniles will develop some component of gastroparesis, and some of the adult onset, type 2s, are also, we're seeing a significant proportion of them that cannot eat because of gastroparesis.
Wow. Okay, so let's talk about this new technology.
So this is a gastric pacemaker, and this was developed by Medtronic about 11 years ago, and I started working on it when I was at the University of Florida in Gainesville, and it was very effective there. It went away for a while. It had to be reestablished as far as its method of pacing the stomach, and then it came back in full force in the last few years, and that's when we picked it up at Baptist Hospital. And a surgeon and I, Dr. Hodgett and I, placed these for people that have really refractory gastroparesis, that have failed medical therapy. So the device is very thin and small. You can hold it. It doesn't weigh much.
Yeah, no,
it has a couple of electrodes that go from the device to the lower part of the stomach. And that's what literally paces the stomach, just like a cardiac pacer, at a certain rate. Our stomach normally contracts at about 3 beats per minute. This will pace at anywhere from 14 to 50 contractions per minute.
Okay.
Once it's placed in the abdominal wall, right underneath the skin, so we can feel it.
Okay.
And we can also then, when they come to the office, our patients can be monitored. That device can then be accessed by this transcutaneously through a computer that I can control to change the settings on the pacemaker, just like a cardiologist would do to a cardiac pacer.
Right.
So this is a very cool device. It's just changed the lives of these people dramatically.
And that was going to be my next question. What have the results been from this?
Within a day or two, the nausea is gone. And these people can eat when they haven't been able to eat for decades at times. They gain weight, they're functional, they're back working. Very impressed. We've done about 40 of these now, and it has completely been a life changer.
So someone who knows already that they have been diagnosed with gastroparesis, or if somebody's exhibiting these symptoms, you say, come in. Come in,
visit, we'll go over the situation, see if you're a candidate. Not everybody is, and if it is, it's a life changer.
Is there anything that anybody needs to know that I perhaps have not asked you about this?
Then go to the website and look at it. We have a nice spread on gastroparesis, and I give a lecture on the whole disorder, and there's a lot of interesting digestive topics there on our website at Borland-Groover.com.
All right. Yeah. Dr. Petersen, good to see
you,
sir.
Casey.
Thank you so much for being here.
Thank you.
Interesting stuff. And again, we'd like to thank Borland-Groover for coming on.